Welcome back to your Caribou Data Science channel, Australia. Today is Wednesday, July 28th here in the US. Before we get started, big shout out to, was it the five people? The five people who watched this video yesterday. Thank you so much for those views. I do have some favors to ask you folks today. First of all, if you haven't done so, by all means, click that subscribe button. We're currently at 214 subscribers. We want to get to 220 subscribers by Sunday evening. Secondly, you don't forget to click that subscribe button, click that share button. Most important of all, click that, like I say, click the like button. Most important of all, click that share button. Okay, click the share button. Share this video on Facebook and Twitter. You can also, of course, copy and paste the link into an email or text message and share it that way. But by all means, share this video today, all right? Before I get started, I have one question I want you to consider. And it's a question that no one really wants to talk about or answer. Suppose COVID-19 never goes away. Suppose COVID-19 never completely goes away. How many deaths are going to be acceptable going forward per year? Okay? That's a very sobering thing to think about. You know? Of course, your numbers in Australia, if they're correct, are crazy low to begin with, so it's not that big of a deal for you folks. Okay, but for a country like America, that's a very serious question. So what you're trying to tell us, what you're saying here, what you've reported so far, is 33,000 cases. You know, one interesting thing about Australia, it's really it's really isolated from the rest of the world. It's really isolated from the major population centers of the world, which is so interesting. So maybe you do only have 33,473 cases. And if these numbers are wrong, what are you panicking for? What are you panicking for? Okay, okay. So this is only 207 cases. You're averaging 142 cases. What about look how crazy low these deaths are. 4 deaths on 726. What are you panicking for? Remember, diseases are measured by deaths and not by cases. We count cancer deaths. Also, we count cancer by deaths by year. So we don't say, well, we had X number of cancer cases, deaths since January 1st of 2020. No, it's deaths for 2020 and deaths for 2021. So this continuous count is misleading because it's constantly going, because he wants you to remember how bad things used to be. But anyway, so as you can see, your deaths are just crazy low. Even though you have 1,000 deaths for this week, cases for this week here, it fell back down last week. Okay, look at these crazy low weekly case number or death number. I don't understand what the panic is for. Okay, yeah, it looks like July cases are going to be the fourth lowest since all the way over here. But look at July deaths again compared to these numbers over here. You only got a couple more days to go. Okay. What about cases per 100,000? Well, this is a tenth of a case of a person. This isn't even a half a person. Okay. These are the number of people per 100,000 that currently have COVID-19 in Australia. Look how crazy though that the same question as far as deaths are concerned. Deaths per 100,000 people. Look at the flat. Yeah, you got a little spike up here, but again, these are cases. Look how flat your deaths still are. Okay, but I'm going to leave you with the question that began. What happens if COVID-19 never goes away? How many deaths from COVID-19 are acceptable per year going forward? Thanks so much for your time, Australia. Hey, don't forget to click the subscribe button. Don't forget to click the share button, share the video on Facebook and Twitter, and we'll catch you tomorrow with an updated report.